Hey guys, Kate here at the AAFE Med Spa. We are treating some frontalis tox. As you can see, I marked those lateral borders of my frontalis and then evenly spaced nickel to dime size injection sites all the way across that frontalis. Typically, I do one lower row, one finger breadth above the brow, and then on my higher row, I make sure that I'm in between those dots that I have on my first line. That just allows me to make sure that I am evenly diffusing product throughout and I'm not stacking product on top of itself. So overall, work in whatever fashion makes sense to you. I usually work left to right, top to bottom. And then obviously always make sure you're injecting all the way over to that lateral border on the other side to make sure you're not spocking a brow. But overall, this is going to give you nice even treatment throughout. Moving on to the glabella complex, we're doing a 5-point injection here. As you can see, I'm doing Perseris at a 90-degree angle, 3/4 to full needle depth, and then that medial corrugator at a true 3/4 and that lateral corrugator at a true half needle depth. So we're really making sure we're tenting up on the tissue here, being mindful of our depth on our medial and lateral corrugators, just because that frontalis lays underneath that lateral corrugator. So if you're too deep, you're going to hit that frontalis and drop a brow. Moving on to crow's feet, as you can see, I marked my injection sites around that orbital rim. You always want to make sure you're over that orbital rim. I'm pulling that tissue taut with my finger and I'm injecting very superficially. So I say just the tip of your needle, or if anything more than that, it should be like a 1/4 needle depth here. So as you can see, pulling that taut. I always like to stand on the opposite side of my patient just so I'm always up and away with that needle. It's very important that you're maintaining safety while you're injecting. So keeping up and away from the eye, make sure that you're not going to accidentally poke your patient in the eye, and it also makes sure that you're not angling down towards the zygoma. So make sure you're following that little tip and trick for you there. Moving on to the temporalis, I place my fingers here and I have my patient contract that muscle. I am identifying that belly of the muscle. So as you can see, that temporalis is really just firing underneath my finger. It is strong. So I'm injecting more the anterior portion of that muscle because that is where this patient experienced those headaches. So I usually do a 3-point injection. I usually taper my dose throughout. So if it's more anterior based headaches, I'm focusing more anterior. And then if it's more medial, I'm tapering back. So just kind of assess your patient and what they're a candidate for. Everyone's treatment's going to be different and specific to them. So keep that in mind overall. But yeah, hopefully this patient gets some relief from this treatment.